The human kidneys are two bean-shaped organs in the renal system. They help the body pass waste as urine. They also help filter blood before sending it back to the heart. The kidneys perform many crucial functions in the body. And because of all the vital functions these organs perform and the toxins they encounter, the kidneys are susceptible to various problems. Kidney problems can cause a range of symptoms like fatigue, trouble sleeping, blood in the urine, and even dry, itchy skin, just to mention a few. The kidneys are very important organs that affect many other body parts, including the heart. Our lifestyles and habits have a lot to do with how healthy the kidney is. For example, eating a lot of salty foods can disrupt the balance of minerals in the blood, and this can affect the kidneys adversely. Now, today is World Kidney Day, and the theme is Living Well with Kidney Disease. It is celebrated across the world to create awareness about risk factors, preventive measures, and how to live with kidney disease, with the objective of increasing kidney health for all. These are some of the issues our guest will speak to on the program. Welcome to Nigeria Today. I am Dennis Adegunloye. All right, now joining us to provide more insights on the kidney is Dr. Adegboyega Faponle, a consultant nephrologist at the Zenith Medical and Kidney Center, Abuja. You're very welcome to Nigeria Today.
Good evening. Thank you for having me presenting.
All right, let's begin with this year's theme, Living Well with Kidney Disease. In your estimation, can one really live adequately well with kidney disease? Why this choice of theme for this year?
Well, the theme for this year is very apt. Gone are the days where we used to think having a kidney disease is a death sentence. So our international body is bringing this to fore to make it known that having a kidney disease is not a death sentence. It's possible to still live well, even with even if a kidney disease diagnosis has been made, and it's important to stress that, and that's why. So really, it's apt, and it captures it really captures. It really makes sense, really. Yes.
Yeah, certainly good to hear that it is no longer considered to be a death sentence, that is a kidney disease. What are, in your view, the risk factors? We know that lifestyle plays a key role in the health of one's kidneys. What also does the role of genetics play in one's propensity for issues with kidneys?
Yeah, very good. Due to no fault of yours, or because of the things maybe you've been exposed to, genetics has been clearly delineated to be playing a huge role in development of chronic kidney diseases. Sides the most popular one, where what we call as the autosomal dominant polycystic kidney disease of the kidneys. Now it's even been established that even people have some genetic mutations vis-a-vis what they call the APOL1 gene. When it's a mutated gene, it was in place to fight trypanosomiasis infection in the past. In fighting that now, you now develop this mutated gene. And this mutated gene has been associated with a variety of kidney diseases, eventually leading to end-stage renal diseases. So due to no fault of yours, or because of the fact that you've been involved with some certain things, or because of some risk factors, it's very possible. Even the popular diabetics that all over the world is known to be the number one cause of chronic kidney disease all over the world. Genetics also has a role to play in diabetics. Eventually, if it's not properly managed, can cause a diabetic nephropathy, then can lead to an end-stage renal disease. So genetics definitely has a huge role to play in for kidney diseases. Yes.
And what lifestyle practices, habits can people exhibit that will put them at greater risk of getting kidney diseases?
Smoking, purchase of, in this particular, again, in this part of our world where people can just go to the pharmacy, oh, my body's aching me, my body's paining me, and just take some painkillers over a prolonged period of time. Then people also wanting, oh, we're black, or I want to be light, and then you take a combination of all sorts of things so that you get your skin will bleach and then become white. Or even people who, because in the popular motor parks where you just have a combination of also what they call their couple, just have a combination of all sorts of things. And don't forget that the kidneys are extremely very sensitive. Virtually everything you take in will eventually have to be filtered in by the kidneys, and on the long run, you take this thing over a period of time, you can damage your kidneys. And that's something very popular. The things I've listed here are quite popular in our environments, because trust me, the kidneys are extremely very, very sensitive.
And salt and sugar, I mean, we always hear of minimizing ingesting those two substances. Why is it that salt and sugar particularly are as greater, is the kidney at greater risk from these two substances?
Yeah, salt, particular salt, obviously that's because of the sodium content. Okay. It's and particularly if you're hypertensive, we often tell you to limit how much of salt you're taking to a teaspoon, just to flatten that teaspoon, and that's all you're going to take all through the day. You know, it's important because you know that salt again has a way of draining. If you take so much of salt, it has a way of draining water, and then you're taking water. So much salt, water, there's an indrawing of water in the body. This can exactly cause some fluid retention, can elevate your blood pressure a bit, and can worsen your blood pressure control over time. Sugar again, of course, again, take too much of sugary things. The popular C's that we used to know, cakes, candies, cookies, over a period of time again, contain so much of sugars, and you perhaps again diabetic. These are not things, they don't go too well. You can't take so much of that over a period of time. They worsen your blood sugar control. Poor blood sugar control again over a period of time can damage your kidneys. And that's why a lot of emphasis also will go into sugar and salt control.
All right, and talking about the various kidney ailments that there are out there, we're all aware of type 1 and type 2 diabetes. Just speak a bit more to us about those two types of diabetes, as well as other potential threats to the kidney in terms of diseases.
All over the world, like I said, diabetics is the #1 cause of chronic kidney disease all over the world. Again, of course, there are little distinction between type 1 and type 2. Not we talk about type 1, there's a particular different way a type 1 DM patient will come down with chronic kidney disease, and there's also a particular way in terms of the progression that you would see a type 2 DM patient come down with chronic kidney disease. For you to have been a type 1 DM patient, you must have had, before you come down with chronic kidney disease, you must have had that type 1 diagnosed probably in early childhood, and you must have stayed on for years, close to 20 years, and then not being properly controlled. Not only does damage the kidneys, but also damage other parts of the body. Type 2, you probably might pick up kidney disease at the point of diagnosis. So usually, because type 2, we see it more in middle-aged people, and so it's at the point of diagnosis of or within 5 years that you now see a type 2 DM patient come down with chronic kidney disease. So in terms of age predilection, in terms of the length of time, in terms of presentations, they differ a bit. But again, the end point is that both of them can damage the kidneys, cause chronic kidney disease, eventually cause an end-stage renal disease.
All right, and how does one identify if they have come down with any kind of kidney ailments? I mean, some of these symptoms that we feel with those having kidney diseases, how can they be readily identifiable so that one can know exactly where to go for help and treatment?
symptoms symptoms can be very multiple. It can come in several dimensions. The popular one is, oh, my face is swollen, and regresses by the day it goes by. My legs are swollen. Oh, perhaps in the diabetic patients, for instance, he might tell you consistent over time, I urinate more at night. I am somebody who probably used to urinate just 2 or 3 times, maybe once at night before. Now I have to go 6 times or 7 times at night. Some people would eventually, in their own presentation, might see blood in the urine. Again, some people in their own presentation might just be frothy urine, except like we talk about foamy urine, like foam, excessively very foamy. And you by the time you pass out urine and you see it foamy, excessively very foamy like urine, and these things over time, you see some at the end point of it eventually is that, oh, I'm not even now making urine at all. I've not made urine all day. Or the frequency of my urination at a particular period, what you call oliguria, is also reduced during the day. So symptoms it's a big cascade.
Yeah.
But yeah.
All right. Let's bring it a little closer to home. In your experience, would you say that there is a prevalence of kidney disease in Nigeria?
Oh, definitely. I many times when I'm having my discussions, I'm thinking, oh, I think it's because of our increased civilization.
Yeah.
There's more rural to urban migration. There's more increased civilization. Well, there's more westernization, and you see more people becoming more diabetic and hypertensive. More people don't have time to take care of themselves again, and you see people who usually they're hypertensive, away from the popular things in the past where, okay, it was infection not properly controlled as a young child, and then you're now seeing middle-aged people, young people who come down with come down and they say, oh, I've been hypertensive and diabetic over a period of time, and we're seeing that those numbers increase. So sometimes there's an explosion, and more number of people come down this way, aside just even the typical infections that will have probably caused kidney infections that will have been the popular things in the past. More people now who are diabetic and hypertensive are coming up now, and yes, there's an explosion.
Sure.
Yes.
And would you say that there is an acceptable or appreciable level of awareness on the part of Nigerians as to the potential threats of kidney disease as it relates to their lifestyles, their habits, and that kind of thing?
Awareness is still very suboptimal. It's still information. It's still very information that the populace has. It's still very suboptimal, and that's why I'm glad we're having things like this year in year out to remind people about the essence of kidneys, the functions of the kidneys, what the functions stand for, what they do, and how well they should take care of themselves. Because you see that when you interact with people, there's just this some people just particularly I don't care attitude that you get around. In particular in your discussions with people. And if people are probably taking care of themselves a little bit more, they probably would not have come down that fast, or probably not have, or even the chronic kidney disease will have been properly managed before it now gets to the end stage disease. So there's late presentation, particularly, and people come down exactly when things have been done, or maybe they've been told they're hypertensive or diabetics. They don't probably even show up again for follow-up after a long time. So again, it's a problem, and that's why this awareness is good, to bring to fore again and to remind us about the fact that we need to take care of ourselves.
Very, very important. All right, we'll take a quick break now. The program is Nigeria Today. Stay with us. We'll be right back after this. All right, you're welcome back. The program is Nigeria Today. If you are just tuning in, today is World Kidney Day, and we have in the studio Dr. Adegboyega Fakonle, consultant nephrologist at Zenith Medical and Kidney Center, Abuja, talking to us on taking care of the kidney and related issues. Doctor, would you say the onset of kidney disease has anything to do with Nigerian cuisine, Nigerian food?
Well, I think a little bit. Like I said, again, there's also, particularly amongst the elites, there's a gradual change in our diet. Really, we also want to become a little bit westernized. We're becoming a little enlightened, and so we're taking more calories. We're eating more salty food, as against what probably used to be the practice in the past. So that again is a problem. You're eating so much food rich in calorie, plenty of food rich in carbs. Now because of the change, and we're coming, education has come in, we've traveled, things have changed, and then things have become a little dysregulated as against what used to be. When are the days where we used to say people in the rural areas, there used to be different studies then. The blood pressure used to be very low because they would not go ahead and go and take anything salty. They eat fresh food and all of that, that village conventional life. But things have changed. We've come to the city now, and there's a little change, and then watching things on TV, and then we're not taking good care. We're just taking good care of ourselves in that regard in terms of our food. So there's a change, and I believe again truly is really contributing to the upsurge that we are seeing in chronic kidney disease.
All right, at the beginning of the program you talked about kidney disease no longer being a death sentence. Unfortunately, stats say that a lot of people, because of cost of treatments, pass away because they've not been able to afford the necessary treatments for what is quite a serious illness. What can you tell to us about the affordability of management of kidney disease?
Unfortunately, truly be told, truly, kidney care is very expensive. I mean, if you look at an average dialysis patient who probably has subject himself to thrice weekly dialysis, he might have, to be spending close to 400 to 500,000 naira in a month to take care of himself. It's quite expensive. Particularly if you are doing it out of pocket. So, aside the dialysis, aside the drug, aside the blood injections that you have to take, you might be spending as much as that in a month to take care of yourself. Not forgetting how much transplant itself can be, that will run into millions of naira, and the fact that you still now have to be on several medications that are also quite expensive. So it's quite expensive. But I'm not also going to say I'm not looking at just the Nigerian situation as a whole. We're looking at global things. The fact that truly it's not a death sentence. It's for government to and all the relevant stakeholders to come and then let's fashion out. Like I said, there's truly an explosion. We're seeing more people come down with chronic kidney disease. We're seeing more people young people, your viral, the strong generation come down with chronic kidney disease. Something must be done. Because many countries where, also they are also back, of course, many countries give their own citizens free dialysis. They don't need to pay out of pocket. As a citizen, and if you have chronic kidney disease, you get your dialysis free. So, why can't that happen here? That's the truth. It's for us to come down together. It's not a death sentence. If we can truly get our acts together and fashion out how things can truly be done.
Yeah, very important. All right. Yes. What would you say about the number of professionals in this field of medicine? Are there enough doctors to handle cases in Nigeria?
Unfortunately, we don't have enough yet. We don't even have enough doctors in Nigeria, even to fitting into the WHO standards. We don't have enough to take care of all of that. But we have more people coming year in, year out, finishing up their training to become specialists in this area, and so the awareness is also increasing in terms of for even doctors who want to specialize. But truly, we don't have enough healthcare professionals to efficiently handle this explosion that's seen in chronic kidney disease.
Yeah, all right. For the past year plus now, the world has been battling the pandemic that we know as COVID-19. What added pressure, if you like, is this having on those who are living with kidney ailments?
That's what has held the world down for over a year now. And again, the kidney has been a major culprit. I mean, from the patients and the clients that we have seen and managed over time, we see that many of them, there's a the virus itself directly affects the kidneys, can directly affect the kidney tissue and temporarily shut down the kidneys. And we've seen people who any other thing was fine, but their kidney function was not all right just because of the exposure to COVID. So a different entity, and a lot of research has gone as to why and what can be done, at least in managing situation. And good enough, a lot of publications have come up, and we have better ways now of managing patients as like in that direction. Yes.
All right. I'm sure at the Zenith Medical and Kidney Center you have counselors who speak on a regular basis to kidney patients.
Yes.
On how they can manage themselves, how they can remain positive.
Yeah.
In view of what they are going through. Well, just give us an idea of what kind of interactions you've had with kidney patients and keeping their spirits up.
Yes. So aside the regular consultations with the nephrologists in clinic, where they do whereby we talk about that, they also have small groups coordinated by the nurses and psychologists in the hospital, and regular pep talks are provided to them. The hospital also has like an NGO arm to also handle for indigent patients that also cannot handle dialysis regularly, give them subsidized dialysis, or will give them free dialysis. I mean, just recently that NGO arm recently paid for transplants for a young boy in that hospital too. So we do that to also lift up the spirits. We also collaborate with other big people in society to see how well they can also sponsor and help sponsor people's transplants, pay for people's dialysis, just to keep hope alive. Aside also the regular monthly pep talks coordinated by therapists, the nurses, and other healthcare workers in the hospital. And that's a regular thing at the hospital.
All right, so very briefly in the last 30 seconds or so, just two issues. Can a human being survive well with one kidney? And then briefly your words of encouragement to those in this situation with kidney ailments, very briefly.
Definitely, you can. I mean, that's a beautiful gift. Kidneys are beautiful gifts from the Almighty, but good enough, and that's why people can donate one kidney. You can survive on one. One can do the job and can do it effectively, can compensate well, even if you don't have any, if the other one is not even working. So one can do the job effectively well. I mean, supporting the fact that people can also go ahead to donate for their loved ones if they need a transplant, and not think, oh, it's not something that cannot be done. Okay, like I started before, it's not a death sentence. It's just a reawakening for all relevant stakeholders to come. Let's come together. Let's see how we can keep that the young people, keep them alive. I mean, it's possible. I mean, it's extremely very possible, and I'm very positive about that. I'm looking forward to the day when people can walk up and say, oh, dialysis is free. We are making many of the things here. Transplants is well subsidized, and people can go about their normal lives.
Sure. All right, Dr. Adegbuyega Lakponle, consultant nephrologist, Zenith Medical and Kidney Center Abuja. It's been a pleasure having you on the program and giving us some insight into kidney ailments and how to manage kidney issues. Thank you very much for your thoughts.
Thank you.
And thanks also to our viewers for always keeping this date with us. Nigeria Today is live at 7:30 in the evening every weekday. You can also watch this and other editions of the program on youtube.com/NTA News 24 Hub. I'm Dennis Adibunloye. Thanks for watching.